When you hear pelvic floor, what comes to mind? Do you picture complex anatomical diagrams or perhaps specialized medical clinics? More often than not, you probably think of women's health. It's almost universally associated with pregnancy, childbirth, and specific female health concerns. But men have a pelvic floor too, and it matters. In fact, it plays a crucial role in several key bodily functions. Millions of men suffer in silence from pelvic floor issues, often enduring discomfort and a diminished quality of life. They are wrongly believing these are women's problems, and therefore not something they should be concerned about or seek help for. This misconception is incredibly damaging. The pelvic floor, a group of muscles and ligaments, supports the bladder, bowel, and sexual organs. Think of it as a hammock that cradles these vital structures. When it's weak or dysfunctional, whether due to injury, surgery, or chronic tension, it can cause pain, ranging from mild aches to debilitating discomfort. This can also lead to incontinence, both urinary and fecal, and sexual problems, such as erectile dysfunction or premature ejaculation. These issues can significantly impact a man's self-esteem and relationships. Most men don't realize these symptoms can be muscular, stemming from imbalances or weakness in the pelvic floor muscles. They often attribute these problems to aging or disease, assuming they are an inevitable part of getting older, rather than recognizing a treatable muscular issue. Doctors rarely ask about pelvic floor symptoms during routine checkups, contributing to the lack of awareness and diagnosis. And men rarely bring them up, often out of embarrassment, a feeling of shame, or simply a lack of awareness that these issues are even related to the pelvic floor. This silence means treatable conditions go undiagnosed for years, sometimes decades, leading to unnecessary suffering and a decline in overall well-being. But you're not alone. Many men experience these challenges, and effective help is available through specialized physical therapy, medical interventions, and lifestyle adjustments. It's time to break the stigma surrounding men's pelvic health and challenge the misconception that these are solely women's issues. Let's make pelvic health part of the conversation for every man, empowering them to seek help, improve their quality of life, and live healthier, more fulfilling lives. Let's talk about a part of your body you might not think about every day, your pelvic floor. It's a group of muscles that plays a vital role in your overall health and well-being. To understand it better, picture a hammock of muscles, stretching from your pubic bone all the way back to your tailbone. These muscles aren't just there for show, they're actively working to support some very important functions. Think of them as the foundation of your core strength, providing stability and control for your lower body. This is your pelvic floor. It's a dynamic and essential part of your anatomy that deserves your attention. It's the base of your core, the very foundation upon which your abdominal and back muscles rely. Without a strong and healthy pelvic floor, your core stability can be compromised, leading to potential issues down the line. More specifically, it plays a crucial role in supporting your bladder, bowel, and sexual organs. These are vital systems that rely on the pelvic floor's strength and integrity to function correctly. These hidden muscles control urination, ensuring you have proper control and preventing unwanted leaks or urgency. They also govern bowel movements, allowing for comfortable and controlled elimination. Beyond that, they play a key role in sexual function, contributing to erections, ejaculation, and overall sexual satisfaction. When you urinate, these muscles consciously relax, allowing the flow of urine to pass freely. Similarly, when you have a bowel movement, these muscles relax to facilitate the process. At these times, these muscles relax. It's a coordinated effort that allows for proper bodily function. The rest of the time, they keep things in check, providing constant support and stability to your pelvic organs. They're working silently in the background, ensuring everything functions as it should. They also help support the prostate, a gland that's essential for male reproductive health. Furthermore, they are crucial for erections and ejaculation, playing a direct role in male sexual performance and satisfaction. Weak or overly tight pelvic floor muscles, whether from lack of use or excessive strain, can cause a range of problems, including incontinence, persistent pain in the pelvic region, and sexual dysfunction. Unfortunately, most men never think about these muscles, often neglecting their importance until issues arise. Until something goes wrong, and they're faced with uncomfortable symptoms that impact their daily lives. But the good news is that understanding your pelvic floor and taking proactive steps to care for it is the first step to better health, leading to improved bladder control, enhanced sexual function, and a stronger, more stable core. Pelvic floor dysfunction in men is far more common than you think. Up to 16% of men in the US experience chronic pelvic pain syndrome, millions living with pain, often undiagnosed. After prostate surgery, as many as 1 in 5 men still have urinary leakage a year later. Pelvic floor issues aren't just for older men. Athletes, desk workers, and men of all ages can be affected. Chronic stress, poor posture, and improper lifting all contribute. Erectile dysfunction affects 30 million men in the US, and pelvic floor health is often a missing piece of the puzzle. These are not rare problems. They're men's health issues that deserve attention. Why do these muscles fail? Causes range from surgery, especially prostate procedures, to years of strain or poor habits. Chronic constipation, heavy lifting with bad form, obesity, and even persistent coughing can all weaken or tighten the pelvic floor. Sitting for long hours, especially on hard chairs, leads to tightness and poor blood flow. Stress and anxiety can cause unconscious clenching, creating a hypertonic, overly tight pelvic floor. Sometimes it's a combination of physical and emotional factors. Recognizing these causes is key to prevention and recovery. Pelvic floor dysfunction shows up in 4 main ways: urinary, bowel, sexual, and pain symptoms. Urinary urgency, frequency, weak stream, or feeling like you can't empty your bladder. Bowel constipation, straining, leakage, or pain during bowel movements. Sexual erectile dysfunction, premature or delayed ejaculation, pain during or after sex. Pain, aching, or burning in the perineum, testicles, penis, groin, or lower back. These symptoms are often misdiagnosed or dismissed as unrelated. If you notice these signs, don't ignore them. They're your body's way of asking for help. Early recognition leads to better outcomes. Why do men stay silent? Social norms teach men to tough it out and avoid talking about private issues. Admitting to incontinence or sexual problems can feel like a blow to masculinity. Embarrassment and shame keep men from seeking help, even from doctors. Many men don't realize their symptoms are connected to the pelvic floor, blaming age, stress, or unrelated injuries. Untreated, these issues can lead to depression, isolation, and worsening physical health. Ignoring the signs doesn't make them go away. It makes them harder to treat. Breaking the silence is the first step to recovery. You're not weak for seeking help, you're smart. The good news? You absolutely can take action today to improve your pelvic floor health. It's not about overnight miracles, but about consistent, informed choices that gradually strengthen and support this vital area of your body. We're going to walk you through some practical steps you can implement right away. These are simple yet effective strategies that can make a real difference in your daily life. Start with posture. Sit tall, avoid slumping, which puts unnecessary pressure on your pelvic region. Think of lengthening your spine, gently drawing your shoulder blades back and down. Imagine a string pulling you up from the crown of your head. Good posture isn't just about aesthetics. It's about creating space and reducing strain on your internal organs and muscles, including those in your pelvic floor. And move regularly if you sit for long periods. Set a timer to remind yourself to stand up, stretch, and walk around every 30 to 60 minutes. Prolonged sitting can weaken your pelvic floor muscles and contribute to discomfort. Even a short walk to the water cooler or a quick stretch at your desk can help improve circulation and alleviate pressure. When lifting anything, even groceries, exhale on exertion. This engages your core muscles and helps stabilize your spine, protecting your pelvic floor from excessive strain. This simple technique helps to avoid straining your pelvic floor. Think about tightening your core as you lift, as if you're bracing for a punch. Keep your back straight, bend your knees, and hold the object close to your body. Stay hydrated and eat fiber-rich foods. Water keeps your tissues pliable and helps prevent constipation, while fiber adds bulk to your stool, making it easier to pass. Both of these habits are crucial to prevent constipation, which can put significant strain on your pelvic floor muscles. Aim for at least 8 glasses of water a day and incorporate plenty of fruits, vegetables, and whole grains into your diet. Cyclists. Use a seat with a central cutout to reduce pressure on the perineum, the area between your genitals and anus. This is especially important for long rides, as prolonged pressure can lead to nerve damage and pelvic floor dysfunction. Not all pelvic floor exercises are Kegels. While Kegels are a common starting point, they're not always the answer. If your muscles are tight, focus on relaxation and deep breathing, not just squeezing. Sometimes the pelvic floor is active and needs to learn to relax. Try diaphragmatic breathing, also known as belly breathing. Inhale deeply so your belly rises, letting your pelvic floor relax. Feel the gentle expansion in your abdomen as you draw air into your lungs. Then exhale slowly and let it fall. Feel the gentle contraction of your abdominal muscles as you release the air. Practice this daily to reduce tension and improve control over your pelvic floor muscles. Aim for 5-10 minutes of diaphragmatic breathing each day, focusing on the sensation of relaxation and release. Small changes add up. Consistency is key. Don't get discouraged if you don't see results immediately. Like any muscle group, the pelvic floor takes time and effort to strengthen and rehabilitate. If symptoms persist or if you experience pain, don't hesitate to seek professional help from a physical therapist or doctor specializing in pelvic floor health. They can provide a personalized assessment and treatment plan to address your specific needs. Remember, you're not alone, and help is available. Sometimes, self-care isn't enough. That's where pelvic floor physical therapists come in. These specialists assess whether your muscles are weak, tight, or both, and tailor a plan just for you. They use techniques like manual therapy, targeted exercises, and biofeedback to help you regain control. Biofeedback gives real-time feedback, helping you learn to contract or relax the right muscles. Urologists may recommend medications or procedures for severe cases, but therapy is often more effective when combined with pelvic floor rehab. The best results come from a team approach, medical and therapeutic. Don't wait. Professional help can make all the difference. Pelvic floor dysfunction is real, common, and treatable. Don't accept pain, incontinence, or sexual problems as just part of getting older. Pay attention to your body's signals and don't dismiss persistent symptoms. Educate yourself and share what you learn. Ending the stigma helps everyone. If you have symptoms, talk to your doctor or ask for a referral to a pelvic floor specialist. Be honest about what you're experiencing. Write it down if you need to. Taking action is a sign of strength, not weakness. Prioritizing pelvic health means prioritizing your quality of life. Don't wait for things to get worse. Start the conversation and take control today.